Organ transplantation is frequently the best or only treatment for end-stage organ failure, although transplantation can be challenging and complex. The kidney is the most transplanted organ, followed by the liver and the heart. In 2018, there were a total of around 146,840 organ transplants worldwide. However, when someone receives an organ transplant, the antigen on the donor organ are recognized as foreign, which leads to the rejection of that organ. That's where suppressant medication come in. It artificially suppresses your immune system. However, it costs 14,000 per patient per year, and the mortality rate is 34% on average. Moving forward, the future of organ transplantation looks very bright. Researchers from Cardiff University in Wales may have found a way to treat this. They were looking for ways to control immune system with immune cells called T cells. So, what is T cell? T cells are immune cells, and they work with cells that produce antibodies to identify and fight diseases. When certain T cells recognize a pathogen you fight before, they stimulate other immune cells to make antibodies to fight off the invader, and some T cells attack and destroy infected cells all on their own, so they can play a role in controlling the immune system. Therefore, it comes to the statement, immunosuppressive drugs in kidney transplantation can be eliminated by manipulating T cells, as it can achieve the control of the immune system, which results in a more sustainable way by decreasing the mortality rate and decreasing the cost. The diagram shows the T cell surgery process. T cells will be purified and isolated from human body. After that, it will be reprogrammed to become selectively blind to the new organ. After that, it will be expanded and reinfused to the human body so that it could still defend the patients against infections and cancer. In fact, there are some successful studies happened in these 2 years. Robert Letcher is Vice Presidential at King's College London and the President of the Academy of Medical Sciences. One of the most significant studies was done by his team. In 2019, this method had been applied to mice and it was successful. To move closer to clinical application, the same team used a humanized mouse model, in which a mouse that had been genetically engineered to lack any immune system of its own was replenished with a human immune system. This allowed them to determine whether infused human T cells would be able to prevent rejection. UK's Medicines and Healthcare Product Regulatory Agency has just completed trials in kidney transplant recipients. The treatment appears to have been safe. There were no serious adverse reactions, and there were hints that it has been proved on existing treatment in the kidney patients. None of the 12 treated patients experienced a rejection episode, while 15% of the control group that did not receive T cells had at least one rejection episode. Moral issues have made many scientists wary of cloning cells even for scientific purpose, and some markers are trying to outlaw all types of cloning research. Germany prohibits any such research, while France is considering easing its ban. Holland, Italy, and several other countries have yet to frame laws about cells cloning. The exception is Britain, the first country to pass a law specifically allowing scientists to try to clone cells for therapeutic research. It is true that the method of manipulating T cells needs a lot of funding. However, this researching team are not alone. Syncona, a venture fund, has invested £34 million in a spin-out company to carry out the trials and refine specifically this technique of manipulating T cells in kidney transplantation. Therefore, the advanced method and techniques may persuade more companies to invest on this field. This field of medicine holds enormous promise for the future, as progress is made in promoting immune tolerance and in persuading tissues to repair themselves. People who once had to receive kidney transplantations may instead enjoy a new lease of life.